Hi, everybody. Welcome back. Dave Eling with the County Department of Veterans Affairs and another segment of Veterans Did You Know? And today I'm with Moni Franks, and she's the director of the Mercy Visiting Nursing Services and Hospice Services here in Muskegon. And we've been talking about end-of-life stuff, what happens and making choices, and good choices we hope. And I kind of kid around saying that, you know, everybody's going to die. So you might as well get used to it. So veterans, you face up to it, you're going to be dead. But here you got some choices before you go, okay? And how you want to leave this world with a blaze of glory, or you want to whimper, or you want to whatever you want to do. There's ways to make that happen, to have your family around you or not around you, or whatever you decide to do. It's kind of involved in your core. If you get that diagnosis of terminal, 6 months, hospice can come in when you made the decision not to aggressively seek treatment for whatever your condition is. You just say, okay, let me have the time I got, let me make it productive. And so I think the thing we talk about is if they're a veteran and they're in the VA system, obviously the VA is going to contact a PISN. If you say this is what I want to do, the social workers within the VA system will contact you, and it's a handoff. It's just not, well, okay, you're out of here, and then good luck, go down the street. You might find, you know, there's a coordinated handoff there. And we talked a little bit about at the end of life, somebody to be with you. If you didn't have a family, even, and we talked about this young man who didn't have a family, had no family members, no son, nobody except that care provider who sat there with him and talked to him, and listened to him, cleaned him, held his hand, just visited. And you mentioned about volunteers. Somebody might volunteer for you. You don't have to be a professional healthcare worker or a licensed anything.
Not at all.
For some of this, I mean, you can volunteer. And what would
well, let me just say that, you know, prior to hospice being paid for by Medicare and commercial insurances,
or the VA,
or the VA, you know, really hospice was run by volunteers. And so when the Medicare hospice benefit was created and approved by Congress and the Senate in 1983, they kept a very significant part of the work done by hospice is required to be done by volunteers. And so it's really a fantastic support to all our patients and families. And as I mentioned, we have a special, you know, kind of veterans volunteer program where we have veterans that are volunteers for us that go out and visit veterans. And we have volunteers that will come in and write your life story, or will actually tape your life story to leave for your friends and families. And when you mentioned that, you know, dying alone, we also have a program which is called the Vigil Volunteer Program. We don't want folks to die alone, and so we have volunteers that are specially trained to go out and sit with a patient, and sometimes even their family, to spend those last hours of life with them so that they aren't alone and that they have the support that they need. So volunteers is a big part of our program, and if you're ever interested in volunteering, we would love to talk to you. We'll give some of the contact information at the end. I did want to also mention, you know, you talked about your social workers from the VA contacting us, and I think that it happens the other way just as often, and that is anybody can call and ask here about hospice, and we will come out and do an information visit, maybe 20 minutes, half hour, and just give you information about what hospice can do for you and your family. And then once you have that information, if you decide to pursue being admitted to hospice, we're the ones that can call and coordinate with the VA. We call the Battle Creek office from here in Muskegon, and we talk to the social workers, and they have folks that specialize in hospice there. And we coordinate, as you mentioned, a referral and, you know, how we're going to work together between our hospice and the Veterans Administration to provide real high-quality hospice care right here in their community. Or if they decide to go to some kind of facility or a veterans home, then we would work to help coordinate that as well. So, and I guess I also wanted to mention, as I talked about the team before, you know, the nurse, the social worker, the chaplain, volunteer coordinator, having a home health aide that can come out and help with meals or help with bathing. I forgot to mention that one of the key parts of hospice is that we have a nurse on call 24 hours a day, 7 days a week, 365 days a year. So when you have that 3 a.m. problem, instead of needing to call 911 and be kind of yanked out of your home and go to the hospital, you call us, and we will come right out to the home. The nurse is available to immediately come out. She has access to physicians 24 hours a day, and we care for the problem in the home. And so it's all around being able to provide care in that patient's place of comfort and care, which is their home, and not have to go back to the hospital. So I did want to mention that to you, Dave, that's a big part of hospice. You don't have to leave. You may stay at home and we will come to you. The nurse, the social worker, all the team members that I mentioned visit on a very regular basis, and then, like I mentioned, you have this access to the 24-hour-a-day nurse for those after-hours concerns, and she has direct access to our physicians for any help that's needed. And then we coordinate that the next morning with the VA physicians. We call, give an update, what has happened, make sure that we're all, on the same page with making sure the plan of care is what the VA is going to work with us, and it is all said and done, and just a very smooth transition for the veterans. So.
Oh yeah, and I think hospice has always had not a bad rap, but maybe a little negative rap is the Grim Reaper.
Absolutely.
Okay.
You're taking my words.
Hospice. Okay, this is all done. But what it really is, it's a nice soft pillow with rose petals all around you.
Absolutely.
When it's there, it's there. That's what it's for. You're not going to go out there. And hospice, I think it's scary, but you need to understand it's putting things the ball in your court.
Absolutely. Totally.
All these people there to support you. What would you like to do?
What would you like to do?
What would you like to have done? How do you want it done? How do you want that brownie served, that cup of coffee? That's what we're going to do. That's what it's all about. So, I mean, it's nice that people will listen to this. Myself, I've known for a long time what you guys do, because I've been on the not receiving end, but very close friends and that have gone through the hospice process, and its mind changing, and its thought process is changing, and it's a great process. It's nothing to be, but it's like the funeral home. People say, but you know what? You got to plan it out.
Right. Absolutely.
Again, for the 5th time, we're all going to die. All going to die. And if you have that the pink slip, and there's a date on it, you can say, you know what, I'm going to go out on my terms.
Absolutely.
I'm not going to. And we're lucky to be able to do that.
We sure
We can all step out here and get hit by a bolt of lightning or a big bird fall in the sky or something like that. You say, oh, God, I wish I would have got that stuff.
Absolutely.
Too late then.
Yeah.
Too late then. But it's something that happens, and not to make light of anybody who's in end stages of life. But you gotta have a sense of humor about life. If you lost your sense of humor, then you've lost your way. And then again, it's a chance to set things right, make things the way you want them, and you can make your end days great days. You can do a lot with those. Yeah.
Well, we often like to say that we really like to help people have that soft landing. Yeah. That we all suffer a lot of bumps in life, but call the experts in hospice. Mercy VNS Hospice. We're at 888 Terrace, and you can just call our number at 231-672-4663, and you'll be attached or connected to the hospice referral coordinator, and we can come out, as I mentioned, and just do an information visit, or if the decision has been made, we'll send a nurse out who will just do a full admission visit. But it's really to help, as you mentioned, folks to be able to have a say in the end of their life, and for us to really help them to have a soft landing as they pass.
There's an old veteran who wrote a lot of helicopters. We talked every 2 years. Soft landing is what you like.
Yep,
soft landing is good. Hard ones kind of shake you up.
Yeah.
But you can use my big soft pillow and rose petals.
I will do that
as
too.
A landing. That
yes, absolutely. Yep. I love that picture. I really appreciate the opportunity to speak with you today, Dave, and just really I'm very excited to have your words about the positive sides of hospice and your experiences. So I appreciate your sharing that, because I think that's one of the things we want to do in hospice, is make this not the Grim Reaper, to make it a comfortable option for folks to look into. We're never going to force you into hospice, but we want folks to be comfortable in exploring the option and seeing if it's the right fit for them.
And I don't think I've ever heard anybody have a negative response to hospice care.
No.
No matter who's providing the hospice care, it's the quality of the people. It's you're dedicated to this way of life. It's a special person that has to be able to do this.
Absolutely.
And it's like the volunteers. You know, if you go to a hospital and you see the little old volunteers in there, they're pushing wheelchairs around, they're always smiling. They're happy. They're glad to be there. Life's good. And they're getting where you want to go. You never see a grumpy one because they're volunteering the time because that's what they want to do. That's what they want to do. And those of you who have chosen this as your profession, kudos to you because it's you have to be a very special person to do this, to provide that soft landing, and you do a good job at doing that.
Thank you very much.
We'll take another break, a quick break. We'll be back in just a few minutes. Thank you.